Le-
Well, good morning or good afternoon, everyone. It's great to have you. We're pulling up the slides here. Well, while folks trickle in, I wanted to quickly say hello and welcome you to the Policy Center for Maternal Mental Health Nonprofit Policy Fellows graduation for 2025. Welcome to our graduates and our guests. My name is Joy Burkhardt, and I'm the Executive Director, CEO of the Policy Center. Our mission is to close gaps in maternal mental health care. And as you can imagine, and of course, our graduates have learned, much of the work necessary to close gaps in care revolves around policy, federal and state. And of course, it's a challenging time at the federal level right now, as we all know. And this just means that the work that we all do at the state level is going to matter even more. It's where the rubber meets the road, and it always has in terms of health policy in the United States at the state level. And so we couldn't be more proud to have an army of trained fellows from nonprofit backbone organizations ready to hit the pavement. Today, we will get to hear from each of you about the work you've done already in the past 12 months, and it's hard to believe the 12 months have already gone by. And in our 12 months, we came to study and learn best practices and educating policymakers, including agencies like HHS and public health departments, and really importantly, Medicaid agencies, as well as elected officials who can draft and introduce laws and help them get passed. We've covered topics ranging from racial disparities, budget advocacy, and working with the media as well. So it's a pleasure for me to get to welcome you. And before we introduce a few others to make remarks, we wanted to take this time to do a group photo. So our graduates, here's our agenda. And look forward to going through our all of these steps, including hearing from a few guests. And next, we want to do a group photo. Thank you, Stacy. So if Rebecca, I'll turn it over to you to ask everyone to turn off their cameras. This is also the time, turn on their cameras rather. This is also the time that we want our graduates to hold up their certificates. Hopefully you all had a chance to print those and hold those up for the photo. So Rebecca, I'll turn it over to you. And Rebecca, you might be muted.
Oh, I am muted. Sorry about that. All right. Let me get you guys all not pinned. And let me take my video off. Okay, I'm waiting. I think Kat Peterson is loading.
Yeah. And I think Rebecca, just in the interest of time, we can go ahead and take the photo and
Okay, I'm gonna go ahead and 3, 2, 1. And I'm gonna do one more.
maybe we can do like, yay.
3, 2, 1. Yay! Amazing. Thank you.
Right. Thanks, Rebecca. While I say thanks to Rebecca, I also, of course, want to say a big thank you to our Policy Fellows project manager, Stacy Porter, who is the person behind the scenes that makes so much of this work possible. Thank you, Stacy, for all the work that you've done with this Fellows program and also our Government Agency Fellows program. And now I want to recognize another special person, a representative from Sage Therapeutics. We are so grateful that this program is made possible through the generous sponsorship of Sage Therapeutics. Sage Therapeutics, as all of you now know, has created the first drug treatments for postpartum depression, now available in oral form. And we are so incredibly grateful for the pioneering work that Sage has done, not only to make this new treatment available on the market, but also to support the critical work that we've been attempting to lead for so long, and all of you as well as policy fellows. So Stephen Schultz, the Director of State Government, who leads policy and even patient advocacy now at SAGE, I welcome you to make a few remarks. Thank you, Stephen.
Thank you so much, Joy. Thanks for allowing SAGE to participate with this amazing fellows program. We're proud to sponsor and work with the Policy Center for Maternal Mental Health. We've seen and been a part of so many of the advocacy efforts across the country and had a chance to work with so many of the different fellows who are all amazing. I'm currently at a conference, Women in Government, that's happening in St. Louis, and throughout the years at these conferences like Women in Government or National Foundation of Women Legislators, we've had a chance to have amazing fellows from across the country come and speak. And even tomorrow, we're going to have not a former fellow, but a former forum speaker, and Emily Johnson, come and speak. But it's a testament to the amazing fellows and the amazing work that each of you and your predecessors have done throughout the years to improve maternal mental health outcomes in your communities and your states. So just thank you for the important work that you're all doing.
Thank you so much, Stephen. We so appreciate you and SAGE and all the work that you and your counterpart are leading in the states around policy and legislative change as well. So thank you, Stephen. We're so glad to call you a partner. I next have the pleasure of welcoming one of our esteemed board members at the Policy Center, and a dear friend and colleague of many years, Jennifer Christian Herman. Jennifer has served in many roles in health delivery, specifically in leadership roles at payers, commercial and Medicaid payers. So Jennifer, a health plan. So Jennifer, we're so thrilled that you are on the board and also here today to make remarks on behalf of the board. I'll turn it over to you.
Sure. Thank you so much. So yes, and also I'm a clinical psychologist, so I think that's where my heart leads in this work. And I'm just here today and want to wish on behalf of the whole board of directors to congratulate you for your year of learning about state policy change. Your success is fundamental to our success and fundamental to closing gaps in maternal mental health more broadly. So we want to congratulate you and just to say that we will be with you as you continue on your policy journey.
Great. Thank you so much, Jennifer. We appreciate you and all the work the board does to support this critical program. So now we want to invite our guests who are joining as invitees of our graduates today to introduce yourself. You can do that verbally, or if you prefer to just do that in chat, please let us know your name and the organization that you're with. And if you're here to support a particular fellow or organization, you can let us know that in chat as well. We'll take a moment to see who's with us.
I'll go ahead and unmute and say hello. I'm Margaret Master. I'm the Executive Director of Healthy Mothers, Healthy Babies Coalition of Georgia. And of course, maternal mental health is such a critical part of our work here in Georgia. And I'm here to support the amazing Miriam Goodfriend.
Hi, Margaret. So nice to meet you. And we love Miriam. Even on our last session, provided some really interesting insight about some things happening in Georgia. So glad that you're here today and that you're also a great champion of maternal mental health. Excellent. Anyone else?
I can go next. My name is Simone Lee. I am the Reproductive Justice Director from the B Collective here in Charleston, South Carolina, and I am supporting our very own Crystal Davis. Congratulations, Crystal.
Thank you for joining us. And I see others, there's quite a few joining us in chat as well. Anyone else want to
Yes.
introduce
Hi there. Good afternoon. My name is Dr. Nicole Lang, and I'm here supporting Kate Littlefield. I'm a pediatrician in Washington, D.C., and recently attended the Maternal Mental Health Forum in March as a representative of the Brazelton Touchpoint Center Foundation. And I recently reported back to my board on the wonderful forum that you all had. And I'm very happy to participate in this and welcoming and congratulating rather the fellows. So thank you.
I'm so glad you're here, Dr. Lang. I didn't recognize you at first, but now, of course, I do. Welcome. Glad you're here.
Thank you.
Hi, Joy. Hi, everyone. It's Jennifer Vendetti, Board Chair of PSI Connecticut, and I'm congratulating all of you, and especially Dr. Samantha Smalls and Jessica Vanderberg.
Thank you, Jen. Nice to see you.
Nice to
Maybe I saw your hand up next, and then Chantel.
Hi, I'm Mary Conley from the Missouri PQC, and I just want to congratulate Kim Hawley and Lindsay Phelps for their work as policy fellows. I know Kim from our postpartum task force here in the state, and I know she's doing excellent work for mental health for parents across the state.
Great, Mary. We're so glad you're here, and I think even to represent other PQCs perhaps around maternal mental health. So Mary, glad you're here and can take back some of what you learned today to those circles. And Chantel, you may have gone away. I don't see you. If you're there, you can go ahead and say hello.
am here. Thank you so much. Well, my name is Chantel Cargill. I am the current president for Postpartum Support International Georgia chapter, and I am here to celebrate our very own Amanda Gorman. Absolutely love her. She has made a tremendous impact on our board and in Georgia and in the world. And I absolutely am so proud. So on behalf of the board of directors, we are so proud of you, Amanda. Congratulations. And a special shout out to Miriam, who is a part of Healthy Mothers, Healthy Babies Coalition of Georgia. We absolutely love her as well. They're one of our strongest partners, and I am extremely proud of you as well, Miriam. So congratulations to all the fellows.
Great. Thank you. And I think we got everyone here, even in chat. Anyone else? Ashley from the Missouri Department of Health is with us as well. Thank you, Ashley, for joining us. And then I think we covered everyone else. Nikki Boyd from the March of Dimes of Kentucky. So glad you're here. And March of Dimes have been great partners and part of our fellows programs as well in the state. So welcome to all. And with that, we are going to jump right in. We have a jam-packed program, and we're going to remind our fellows that we are asking that you keep your presentation to 3 to 4 minutes. There are more of you than ever before, and we know that we have a talkative and energetic group. We are going to set a timer at the 3-minute mark so you know to start wrapping up. And then, unfortunately, I'll have to move you along. At our last graduation, we ran out of time for one of our policy fellows pairs, and so we are really trying to avoid that scenario today. So without further ado, we're going to jump in and hear from our policy fellows from South Carolina first. And what I'd like you to do is just a reminder to introduce yourselves, your name and your organization before you jump into your action plan. South Carolina, over to you.
Good afternoon, everybody. My name is Talisha Jennings. I am the advocacy chair for PSI South Carolina. I am also a PMHC and a licensed clinical social worker in South End, North Carolina.
Hello, I'm Crystal Davis. I am also with PSI South Carolina, and I am the Alliance rep for the Providers of Color.
And you can go ahead and jump right into your presentation.
Okay. We have one more member. I was looking to see if she was going to introduce herself.
Oh,
Sorry,
Sandra, that's right.
I didn't think you couldn't hear me. Good evening or good afternoon, everyone. My name is Amaris Gibson, and I am from the South Carolina Infant Mental Health Association. So excited to be here with this team today. Thank you.
Awesome. Okay, so I will jump right in. So with PSI South Carolina and Ameris' group, we are looking forward to the work that we're doing here in South Carolina. Our goal number one is to work with Mind the Gap to support advocacy in regards to bills that promote the maternal well-being, so mental health and physical wellness in the state of South Carolina, specifically around bills that increase paid paternal leave to 12 weeks and paid maternal leave to 12 weeks. Now, the reason that we're starting with those specific goals is because we recognize that a lot of parts of South Carolina are operating in silos. So there are a lot of different people doing this work, but it's all over the place. So if we focus on the particular bills and policies that will lead to our ultimate goal, which is South Carolina's version of a momnibus, we'll take the baby steps to get the action that we need, and the boots on the ground, and to be able to get our goals met. So our objective for goal number 1 is to increase provider knowledge, confidence, and skill related to maternal mental health screening, treatment, and navigation of our local system of care. And the second objective is to educate the community members on upcoming legislation and how to track a bill and how to advocate for these changes. So we have a lot of different activities. We've already started some of this work by doing speaking engagements, conferences, different things. And Crystal can speak to some of these because we did one together back in March. But just making sure that we're community facing in regards to what we're trying to accomplish. And then also as an advocacy chair for our board, providing education on a smaller scale to educate our board members and our group members or committee members on how to navigate these waters as well. Crystal, did you want to add something to this one?
No, you covered everything.
Okay. Yep. Thank you. So then we'll go to slide number 2. And then our second goal is to increase provider and parent knowledge, confidence, and skills related to maternal mental health, and screening, treatment, and navigation of local systems of care. So again, we're basically working towards educating and advocating in the community. So on a grassroots level, and ultimately lead to a more political level of this goal. Crystal?
Yeah, and I wanted to add that I have identified just this week a grant for up to $30,000 that would help us to be able to get started with this objective right here, of educating advocacy, um, local community organizations and partnerships, and also increasing the education and awareness for the families that we speak about in our rural and BIPOC communities.
Absolutely. I just saw that too. Thank you. And the other thing that we're doing, we are partnering, we just got confirmation last week. We are partnering with the March of Dimes here in South Carolina, a part of the Mind the Gap series, in order to work together with other organizations in the state to increase this maternal mental health and wellness goals that we are trying to accomplish, because South Carolina needs it. We need it bad. And we're out here trying to do the work to make sure that we get what we need so that our parents are surviving and our children and families are healthy and well.
Great. Well, thank you all for participating this year. It's exciting to see how your goals have come together, and we will be here to support you with this second goal in particular around screening policy and the levers for change. And just a reminder, I dropped into chat for everyone to look at the recipe for change that we suggest is on the webpage here, including convening task forces. There's screening mandate bill, but we also have research on screening mandates and what really works around payment levers, et cetera. So we will be here by your side, as Jennifer Christian Herman mentioned, to make sure that your efforts are successful around that goal in particular. Congratulations, you all. I'm going to turn it over to Cassie from California. And Cassie, it seems like you're on the treadmill as always, even during graduation. So welcome, and my hat's off to you for keeping in such great shape. A good reminder for the rest of us as well. Over to you, Cassie.
Thanks so much, Joy. We're all in movement together here, right? Working for perinatal mental health and justice. So I'm Cassie Gardner-Manjikian, a postpartum psychosis survivor, board member of Maternal Mental Health Now in Los Angeles, and a co-founder of the new California Perinatal Wellness Alliance, which emerged during this fellowship. And Dev, or actually before Dev, you introduce yourself, I'm also sharing today on behalf of my colleague, Lee Springer, therapist and PSI California board member, who's unable to join us. Dev? you like to introduce yourself?
I would love to. Thank you, Cassie. I'm Deborah Herbert, a documentary filmmaker, production designer, and now a perinatal mental health advocate and co-founder with Cassie of the Coalition for Perinatal Mental Health and Justice. Really proud to be here doing this work with all of you. It's just so meaningful and important.
Great. Thanks, Deb. So California currently holds the highest grade on the Policy Center's report cards of a B+, but as we know, that's far from good enough. And our coalition was born out of the urgency and belief that we can and must do better, especially for Black, Brown, marginalized communities facing disproportionate perinatal mental health burdens. So during the first phase of our coalition and work, I initially approached my assembly member with my personal story, and we used their template to draft a policy platform, including perspectives from survivors, clinicians, and advocates. And we together identified the need for follow-up and accountability around implementation of AB 2193, a bill that was passed in 2018. So we partnered with Black Women for Wellness and a wide variety of state perinatal mental health nonprofits and formed our coalition. Then in phase 2, from November to January, we shared our platform with over 20 state legislators and found a powerful champion in Senator Smallwood Cuevas. And her relationship with our ally organization, Black Women for Wellness, really opened that door. And on February 20th, she introduced SB 626, which came from our policy platform and would mandate screening, diagnosis, and treatment based on ACOG guidelines, case management and care coordination, public data reporting, and inclusive language reflecting diverse perinatal experiences. Next slide, please. So during our next phase of the coalition, in April, we organized our From Pain to Power Advocacy Day at the state capitol, where more than 40 advocates from throughout the state participated in 51 legislative visits ahead of its Senate Health Committee hearing. And Dev would like to share a story about that hearing.
Yeah. As I have been thinking about how we struggle to protect women's basic rights, healthcare rights in this country, it's awesome that SB 626 has been meeting with universal bipartisan support. And I think that's because of storytelling. So I'll tell you a very short story. The day before the first hearing, our coalition gathered in Sacramento at the Capitol building for a day of lobbying, knocking on doors, and sharing our stories with legislators. And then the following day at the hearing, we had just a few minutes to plead our case. Jessica Walker from Beam Aware shared her story of
That's the
surviving.
1 minute reminder, by the way.
Love it. I'm 2 sentences away. Jessica was sharing her story and she got cut short. But Senator Menjivar, who's the chair, very moved and granted her extra time. And then, in a moment straight out of a John Grisham novel, when it was Republican Senator Suzette Valladares' turn to vote, she took the microphone, shared her own story of postpartum depression, and offered to co-author the bill. And it was an amazing moment. Now we have a bipartisan bill, and we are so close to bringing better care to so many women across California. That's it.
Yeah. Thanks, Deb. I just wanted to share for next steps, we're starting a statewide storytelling campaign. And we invite all of the fellows and partners on the call to connect with us and explore how our tools can support your own states. And we'd love for you to join our newsletter, which I'll be sharing in the chat. Thank you very much.
Amazing. Yep. And integrating funds through a tax that is in place in California. So just wanted to raise that as well as a great strategy. Thanks and congratulations on some incredible work in California. Truly. Next up are our partners in Connecticut.
Hi, everyone. Oh. Good afternoon. I know we have a short period of time, and don't threaten me with a good time. I like short. My name is Dr. Samantha Smalls, and I'm representing PSI Connecticut. I sit on the board as a secretary. I'm also the owner and founder of New Chapter Counseling Services, and I just passed my perinatal mental health certification exam, so I just want to put that out there for razzle dazzle. Go ahead, Jess.
Congratulations, Sam. My name is Jessica Vanderberg. I'm also here from PSICT. We're really grateful that Amy and Jen could be here as well. I am a social worker, a doula, and the founder of a perinatal mental health center in Stamford, Connecticut. And so Sam's going to start and I will finish.
Yes, so we're going to get right into it because we have a great timeline that we actually get to see from finish to end, and proud and happy that Jen and Amy are able to see this as they were a part of this process. So our first goal was to establish a maternal mental health day in the state of Connecticut. And then we moved to developing Connecticut's maternal mental health impact report and action framework. And the report card helped a lot as we stand with a D, even though is at a D, we are trying and we're working very hard to bring that grade up, and we're hoping for a better report card this next cycle around. And then the third thing we wanted to work was to meet with representatives, stakeholders, and make appeals for need for maternal mental health task force, where we were able to identify our champion, which in a state representative as Kai Belton, along with her peers, who are the founders of the Black Maternal and Infant Health Caucus in the state of Connecticut. So that's where we started. So go ahead, Jess, let's go through this great timeline.
Sure. So as Sam mentioned, those were our 3 goals. Anything you see with a green check mark actually means we met those goals. So we met all 3 of our goals for the year. I won't give all the details, but I'm happy to share this with the group afterwards so you can see the progress on the timeline. We established the Maternal Mental Health Day last May, and that first slide should actually read, which was my fault, it was an accident, established an ongoing Maternal Mental Health Day for the state of Connecticut. So we were able to continue that tradition this year. By August, we built our risk assessment, which we were able to provide with our first meeting to Representative Belton's office. And then she invited us to speak with the Black Maternal and Infant Health Caucus, which was a bipartisan, made up of 24 legislators in Connecticut. If we can go to the next slide. You'll see that there were some House bills included in here, which was not part of our goal, but was actually something we were also able to accomplish in this cycle. But the public hearings that where you see the green check mark here show, again, meeting our goals, but we were very successful in being able to sort of move out of the goals and into some next progress steps. We're very happy to report that as of early June, after some amendments, HB 7214, which was originally a single bill, was baked into 2 other goals, which is really small here, but you can read it later, including our making the case for a maternal mental health task force in Connecticut, was passed in both the House and the Senate in Connecticut. And here we are.
Yeah, and just to add a little bit to that too, because I don't want to take away from the work that we did with having a breakfast with legislators and being able to present to them, to get more support around the bills, and even helping Kai Belton in drafting and coming up with some of the language for the bill. We were in the mix in the development of this bill. That changed from one number to the other because it wasn't strong. Well, not that it wasn't strong enough to stand alone, but when it's more than one thing's going on at the same time, you don't want one to get dropped when everything else is a great idea to put together. So we were able to combine the bills and, have the funding and reports and everything done, and for it to come out successful as of June 6th, as being the day where it's passed. The last day when legislative close was the day that was passed, along with another bill that we had nothing to do with, but a one around doulas. That was even great to say. So Connecticut, we're gonna have a B+ next report card.
Love it. Congratulations, you two, on incredible work. It feels like even since we had our one-on-one, a lot has happened with combination of the two task force bills. And of course, the resolution is such low-hanging fruit. So smart policy work there on both of your parts. So we're so grateful to have you in the program. I did also just want to quickly mention that Connecticut, South Carolina are two of the states with some of our lowest grades in the report card, Ds, and often folks are surprised to hear that that's the case with Connecticut. So all the reason to get you leaning in and support you on your ongoing effort. Thanks, you two. All right, up next is our Georgia Fellows, who also have a D in Georgia on their state report card. So I'll turn it over to you all.
Hello, everyone. My name is Amanda Gorman. I am the Program and Policy Manager for PSI Georgia, and I want to throw it over to my partner, Miriam, to introduce herself.
Hey, y'all. I'm Miriam Goodfriend, the Policy Director at Healthy Mothers, Healthy Babies Coalition of Georgia. And yes, we have a D. We're working very hard. It's a little bit of a different landscape than California, Connecticut to get these bills through, but we're excited to have some updates for you this year. We've been working our legislative journey this year, perfect timing. We worked a few years ago to establish the Perinatal Mental Health Task Force through recommendations of the Policy Center. And so Healthy Mothers, Healthy Babies, in partnership with PSI Georgia, including the Department of Public Health Maternal Health Office, started convening a group of advocates, providers, community members, those with lived experience, and anyone across the perinatal professional spectrum, and local community partners. And with that input and the Policy Center outlines, we got a draft bill introduced by the chair of the Women's Caucus, Representative Karen Bennett. It got through the House Health Committee and was stalled, as we say, in the Rules Committee. It is going to be up for consideration again in January of 2026, and we are really excited to keep working on that. If you could hit the next slide, I will briefly go over some of those provisions. This, again, really follows the blueprint that's laid out by the Policy Center. So big shout out there on helping us back up our arguments and go and educate legislators with all of those things. We also mobilized the task force and used monthly meetings and monthly convenings to do advocacy trainings, community messaging workshops, resource guide development. So not only were Amanda and I around the state, but we could use the task force to exponentially increase our reach and our communication and the legislators we could come in contact with. So the bill covered screening requirements and allowed for a universal screening so that we could better track utilization and make sure that everyone has access to the best tools. As well as expanding the coverage, making sure insurance, public and private, are covering these screenings. And as well, there was a piece at the end for a 3-year pilot program for our high risk and rural areas. Georgia has 159 counties, and up to 30% of those are maternal care deserts, and they're in rural spaces. And that overlap is really harming us in this crisis. There's also a quality metrics program to track, excuse my dog, to track the outcomes and implementations. And I will toss it over to Amanda so my dog can keep doing her thing.
Thank you. Some other actions that we have in our action plan is the resource guides and making those available both in print version that we have been diligently getting out to all over the state through our task force that Miriam and I host. As well as we have an online version that we're able to update regularly. Looking ahead, we are also monitoring PMHCs with Medicaid. We're exploring payer claims databases, as well as working with a Georgia Council for Recovery to work on getting a maternal certified peer specialist certification available in the state. And another thing about our bill is that we also had bipartisan support. A big thing that we ran into was timing, unfortunately. And so we are in a really good spot to hit the ground running, like Miriam said, in January of 2026. And so hopefully we can get this over the finish line then. Thank you so much.
Congratulations, incredible work, ladies. And just a reminder, there are some resources on peer support on our website. And I think we actually had a chance to meet with leaders in Georgia. So those that are looking to do more work in peer support, stay connected and we'll get you connected with folks in Georgia and Utah as well. Kentucky, over to you.
Hello, everyone. I'm Amy Young. I'm an associate professor at Spalding University and the advocacy chair for PSI Kentucky. I'm also the chair for PSI Wyoming, but that's my other hat. I'm really happy to be here today. My partner in our clinic and in this project and in the fellowship, Nora Chapman, could not join us today. So I'm going to be presenting the Kentucky results to y'all. So our plan really was dedicated to thinking about two things. First of all, the implementation of Senate Bill 135, so the Momnibus bill that really has changed the landscape in Kentucky. And so one of our goals was to really think about not only advocacy around that implementation, but to think about some of the task forces, some of the training and education, some of the things that need to be developed to support that. As providers and teachers, Nora and I felt like we have really good a good lens and a good foundation to be able to support some of the legislation and advocacy because we're involved in that work and in those circles, but also thinking about kind of the provider needs when we talk about some of the bills connected to screening and education and development on that front. So one of our goals was to focus on creating those maternal mental health task force, which we've been able to do effectively. We now have several task force across Kentucky, which are uniting the Commonwealth. For folks that don't know a lot about Kentucky, we of course have Louisville and Lexington are the large metro areas, but most of Kentucky is really struggling with rural disparities, lack of providers, and a lot of concerns around economic issues and access to good healthcare and advocacy concerns. Nikki Boyd, who's joining us today from the March of Dimes, who is amazing. She and I were able to take the policy series that we worked on through PSI around the Mind the Gap kind of guidance and mentorship to create Mind the Gap Kentucky. So we now have our own nonprofit branch, and that work group is dedicated to advocacy across the Commonwealth. So Nikki and I were able to partner together. So the March of Dimes had an amazing March of Change for Frankfort, kind of at the legislative capitol. We were there to kind of support House Bill 627, which is dedicated to increasing screening. We were there to support House Bill 90, which is increasing support for freestanding birthing centers, which would be an amazing addition to the Kentucky landscape, and also legislation connected to increasing the role of doulas. We're involved in increasing paternal leave access bills. And so the March of Dimes and PSI, through this Mind the Gap project and coalition, have now created long-standing advocacy relationships where we are meeting on the regular and we're forming those work groups and connections that are really going to help us to be able to be good advocates for all the legislation in the future. We've had several days of advocacy at the Capitol. So through the March of Dimes, also with the KPA, which is the Kentucky Psychological Association, helping our fellow psychologists, because Nora and I are licensed psychologists, but helping them to recognize the need for maternal mental care and some of those advocacy bills. So we've been able to kind of help some of our colleagues also join in those legislative initiatives and be able to continue the dialogue. And then our last piece, we have ongoing work on the Medicaid programs and platforms across the state of Kentucky. Nora and I have led a research group to create an integrated screening tool. It's called the R Moms. So folks are looking for very quick and easy to deliver screening kind of methodology. We're now moving into beta testing. And so that's a piece of that legislative goal as well, is if we're going to increase kind of action and advocacy around screening, then we need to have a tool that more folks would be able to utilize, not just licensed psychologists, but folks who are going to be working in platforms and spaces all across our region. So we have ongoing work with Medicaid to be able to continue to kind of implement and kind of pilot out that screener as well. So those are some of the things we've been able to accomplish, and super grateful for all of the partnerships that have been created through this project and this year of studying and training.
Great. Thank you, Amy. And I can just, I love hearing your Southern drawl. It's fun to hear you present on a number of fronts. And keep up the good work in Wyoming too. Hopefully we can pull you back in to represent Wyoming. Next up are our friends at Louisiana. And I'll just say there is so much good work happening in Louisiana. on a number of fronts, passed legislation and also government agency fellows in our program as well. So I'll turn it over to our nonprofit fellows now.
Hello, everyone. Hello. I'm Dr. Victoria Williams. I'm the postpartum support and international board member. And I mean, our commitment to advancing maternal mental health policy and addressing two critical areas around early screening as well as sustaining access through Medicaid. Our goal is centered around improving maternal mental health outcomes by expanding the window of screening and including the prenatal period. There are currently gaps in policy around that overlooks this reality of many birthing people who experience symptoms in the prenatal period. And this is very personal to myself because I was one of those that did not didn't really know the symptoms and what was going on in my prenatal period, but I did have prenatal mood and anxiety disorder for giving birth. And so to address this, the PSI, Louisiana, and other legislative champions and advocates in the state of Louisiana, we have we call it the Mama Plus policy agenda, which is so fitting that Kentucky brought the Momniverse up because our policy agenda is definitely mimics those same titles, not same titles, but we also have 9 titles that cover social determinants of health for all birthing people, but specifically uplifting experiences of Black and brown families. So we're really looking toward resolution or requirements that require universal prenatal mental health screenings. We already have existing policies around the postpartum period. And so that's one of our goals. The second goal will be focused on aligning Louisiana Medicaid policies with evidence-based standards to remove costs and access barriers to care. Our key post-fellow priority is to engage directly with the Medicaid leadership to explore and recommend reimbursement models for PMAs, specifically looking at the state of Pennsylvania. Who's Pennsylvania? Thank you for all your work. This will also include advocating for clear, concise billing guidelines for providers and addressing this coverage gap across the perinatal continuum. Together, we hope that these goals advance what we call like this undefined vision around this policy and kind of answer some of the blind spots that we've heard and seen in our communities. And then we want to be able to create a system where Louisiana maternal mental health feels proactive and equitable and sustainable, and encourage our families to have access to all care throughout any continuum of their pregnancy and childbirth experience. So thank you so much for having me. It's been a pleasure to be a part of the Policy Center, and I hope to hear more from everyone and collaborate very soon.
Thank you, Dr. Williams. It's so fun to hear what you're up to, and I'm delighted about the work that you're doing around maternity care and screening. So thanks for everything. All right, up next, some more go-getters from Maryland. Over to you guys.
Thanks, Joy. Hi, everybody. My name is Mika Goldman-Berg. I work for Postpartum Support International. I'm the Assistant Director of the Chapters Program.
Hello, my name is Sone Taylor Brown. I currently work for the Department of Veteran Affairs as a program manager, and I am also on the board of PSI Maryland as a policy advocate. Next slide, please. So these are our goals that Mika and I have had for this fellowship. We have learned so much during this fellowship, and based on what we've learned, we've focused our goals on the following 4 buckets, in which we have accomplished a lot as well. We gained awareness of the perinatal health landscape by networking and researching how perinatal mental health is affected in Maryland. We researched legislators to determine which ones have or want to have more impact regarding perinatal mental health policies. We have also collaborated with legislators by networking and crafting legislation to support maternal mental health. Mika and I also targeted agencies that we believed have a huge impact on maternal mental health in the state of Maryland to build a better relationship with them going forward, as well as putting the Policy Center and PSI Maryland out there to let agencies know that we are here as a resource for them, which I feel like they really appreciate as well. Next slide.
So Sonia and I really did like a perinatal mental health landscape of Maryland to really see where we could have the biggest impact. And I think a big piece of this was identifying legislators that were either currently working on legislation that impacted maternal mental health or had previously worked on them. And we really did a ton of networking to the point where actually senators are now reaching out to us for more information and crafting legislation going into the next session, which has been really exciting. One of the things that we also found out or like realized as we were doing a lot of research is that federal funds for Medicaid really impact Maryland a lot. We have a big budget deficit in Maryland, so we really pushed also with our networks information about federal Medicaid and how it impacts all of our citizens and families in Maryland. We connected with our MDPQC, which connected us to the Maryland Patient Safety Center. We are on now quarterly and monthly calls with them. We have a great relationship with them, which has been really great and exciting to have that connection. We did some agency advocacy with the Maryland Department of Health, in which we now, PSI has a contract with the Department of Health in Maryland to increase our PMHCs. So there's a 3-year contract to train 3 cohorts of providers to increase our PMHCs within Maryland. We have reached out to Medicaid with less success, but so that's an ongoing project. And overall, we've just done a ton of networking, which has been so, so important. That's like breakfasts with our legislators, connecting with the Maryland Mental Health Association really opened a lot of doors for us, and also peer support. Okay. Next slide, sorry. So next steps, continuing our relationship with the PQC, making sure that as we're pushing forward legislation that it includes ensure case management programs. We also made a lot of headway with peer support. In Maryland, there's a certification for substance abuse, but not for maternal mental health. So we're working with them on figuring that out. And also there was one bill that we were working on that did pass, was an interstate social worker licensure bill, but the other legislation we were working on did not pass. So we're kind of working with those offices to create more robust legislation moving forward, using a lot of the model legislation from the Policy Center.
All right, and regarding future initiatives, like Mika said, we're just going to continue our relationship with PQC regarding our monthly and quarterly calls. We're going to explore maternal mental health peer support certifications with our reps and prepare to introduce screening mandate bill to include model legislation and advocate for ensure case management programs for maternal mental health. But we just thank you all so much for everything and the opportunity. Thank you.
Great, you too. Thanks so much. So much happening in Maryland. Missouri, we'll turn it over to you. Hi, Kim, I see you.
Yes. Hi, my name is Kim. I'm the president of Whole Parent Foundation, a nonprofit in Kansas City. I also am the statewide coordinator for Postpartum Support International, Missouri. And then I'm also a licensed social worker.
Wendy. I am a board member on for Whole Parent Foundation. And then I am also a data analyst.
All right, so we wanted to start with what we accomplished this year. So we were lucky enough to work with the Missouri Hospital Association, the Missouri PQC, and the Missouri Department of Health and Senior Services in partnership with Governor Mike Kehoe to proclaim May as Parental Mental Health Awareness Month in perpetuity for our state. We were able to connect with others at the governor's office and be able to talk about policy that could advance maternal and parental mental health. We also were able to pass Parental Mental Health Awareness Month in Kansas City as well. And so I also was very, very lucky to join the statewide task force that created the Postpartum Pathways Report that outlines health and mental health guidelines for postpartum care in Missouri, and that will be released later on this year. And what's really wonderful is that mental health, I mean, we met so many times and it was such a wonderful task force, and mental health is really the through line of the report. We're really proud of it and excited for those to come out. And so many of those people are on the call today, so thank you all for being here.
Excellent. I think you might be done.
Yes, thank you. Next
Very
slide.
good. Awesome. Congratulations. And Kim, both of you, Lindsay and Kim, have heard so much in our one-on-ones about the incredible work that you're doing, the partnerships you're forming with agencies. So congratulations. We'll be keeping an eye on what happens in both states, but Missouri in particular. So thank you both.
Oh, sorry, Joy, will you go back? We still have some action items.
Oh, you did have another slide.
We did.
Yes.
You're
Yes.
good.
You did not,
Sorry.
you did not give me here. Thank you. Sorry about that.
So we still have more to do. We have spent some time already kind of generating press and content for the proclamation, and we will continue to publicize this accomplishment. As Kim mentioned, it was passed in perpetuity, which means that we'll be able to talk about it every year. Our next steps include writing big thank you letters to the supporters who helped us, work on this and pass this proclamation. And then we will continue to engage with existing partners, and we made a lot of new partners through this process as well. So we're excited to collaborate with them. The last thing on our list for right now is to schedule formal meetings with stakeholders. We have one meeting already scheduled with the Mayor Pro Tem of Kansas City in July. So we are excited to talk to her about some additional collaboration opportunities for Kansas City. And then we're looking forward to continuing this work in Missouri as in the state to improve perinatal and parental mental health. So thank you so much to the Policy Center for having us and for teaching us and mentoring us so much over the last year. I'm just really proud to be here. Thank you.
Great. Thank you. So glad to have you both. All right, we will turn it over to our next pair, Nebraska.
Hi, I'm Jennifer Rokeby-Mayu, representing PSI Nebraska chapter. I am perinatal mental health certified and a clinical social worker in private practice. And Emily is also on with us today. Emily, would you like to introduce yourself?
Hi, I'm Emily Goodman, and I am a perinatal mental health certified therapist as well. I'm also the founder of the Nebraska PSI local chapter and the current education co-chair with Jennifer, and in private practice in Lincoln.
Great. And I don't believe that Sarah Howard, who is the other fellow, was able to join us today. She's just getting back from leave. So, but she represents First Five Nebraska. So what we did this year was had a legislative resolution dedicating May to Maternal Mental Health Month. And we had asked that all female senators sign that, and they did. So that was a win to get 100% participation there. What we're going to be doing next is this fall, with Sarah's help and help of some other partners, we're going to introduce an interim study on maternal mental health, and again, hope to launch that by fall. And starting this summer, we are working to increase engagement with our partners in the community and across the state. And also using that ongoing partnership with our local leaders to begin and continue to disseminate information on maternal mental health. Next slide. And next May, we plan to extend the proclamations to cities across the state, and hopefully then have a little bit more coordinated effort in just bringing some awareness and knowledge, not just in where our populations are centered in Lincoln and Omaha, but across the entire state of Nebraska, which is vast and not very populated. But we know that there's women and families out there that are struggling. And so again, Emily and I represent PSI Nebraska chapter, and Sarah is with First Five Nebraska, which has been a really great partnership, not only with First Five Nebraska, but also just with Sarah's personal background as a former state senator. She brings a lot of knowledge and an experience that we're hoping to tap into this next legislative session. And that's it.
Great. Well, thanks, you two. We look forward to seeing what happens in Nebraska going forward. And up next are New Jersey fellows.
Hello, everyone. My name is Janine Cook. I am a licensed professional counselor here in the state of New Jersey. I previously was the advocacy chair for Postpartum Support International, which is where I started my work on monitoring and advocating for bills in our great state. Also certified with perinatal mental health. So I received my PMHC through Postpartum Support International in July of 2022. I currently work for the Children's Home Society of New Jersey as a nonprofit therapist, working predominantly in adoption. And what May and I were doing with our project is we were putting our effort into researching and monitoring two bills that are currently moving forward in New Jersey. We have Bill A1700, which has a focus on public awareness. That bill requires the Department of Health to establish a public awareness campaign and develop policies and procedures to promote recognition and treatment of perinatal anxiety. Its last action was on May 12th of 2025, and it's engrossed at 50%. The second bill that we're currently monitoring is A4193, and that bill requires licensed healthcare professionals providing prenatal care to offer and screen upon request of the pregnant patients that have a history of depression. So that requires screening for postpartum depression. That was introduced and currently is at 25%, and the last action on that bill was October 17th of 2024. And then a bill that's very near and dear to my heart because I feel like I've done all of my work on it is Bill A4094. And that is a more extensive bill that requires the Department of Health to expand services provided under the plan to improve perinatal mental health services. And it basically requires health insurances to cover the costs of perinatal mood and anxiety disorder screenings. But something that we requested to be added to that bill was continuing education for any individual that's working with the birthing population of pregnant individuals to receive at least one credit of continuing education in perinatal mental health. So that would be not just doctors and midwives and nursing staff, but also doulas, birth workers, pediatricians. And we also asked for screening to be done at the pediatric appointments because typically you see your pediatric provider within, 3 days of the discharge from the hospital with your baby, as opposed to having to wait 6 weeks before you see your primary care provider, your OB, your midwife. So we are hopeful that this bill will move forward and that the request that we had for this bill will be recognized and honored, and we'll see more information on this coming in the near future. And with that, I'm going to turn it over to May, and she's going to pick up to discuss our Maternal Mental Health Day and the work we're doing on that. May?
Thank you, Jenny. This is May. I'm PSI New Jersey chapter board member, as well as I'm public health professional working at the College of New Jersey. So the second action we try to collaborate with Nurture New Jersey and hopefully add a day or week for maternal mental health. You know, in 2018, New Jersey was the first state to get the Maternal Health Awareness Day, but we're a little behind for the maternal health related, maternal mental health related information. Fortunately, we met with the current leader, and hopefully we can continue working with them. Okay, let's end right here.
Well, you got a minute. You have a minute.
Oh, okay. All right, then I will continue explain for this one because this is 20 years. New Jersey is the first state to start the postpartum anxiety in 2005 by the governor. And maternal mental health is a little behind. We try to catching up compared with other issues because chronic diseases, chronic condition for the mental health, anxiety or depression also, if untreated, also cause the issue with increased risk with other physical health as well as pregnant outcomes. So we really want increase, as you can tell, public health professional, I really want to work on increase public health awareness because this is really foundation for us to decrease the stigma and also increase the mom who need help can seek for help. That's the initiate organic from moms. That's the one we really want to working on. So hopefully we can get New Jersey Maternal Mental Health Day in next year. Thank you.
Great. Thank you both. And I think folks do remember New Jersey was the pioneer in maternal mental health legislation with one of the first ladies introducing legislation that there was analysis showing that what was done really isn't leading to better outcomes. And it's really this year, the first year that we're seeing more action in New Jersey. So it's exciting and so glad that the two of you are there to make shepherd these bills and make adjustments as appropriate. So very exciting. All right, up next is Oregon. Let's see, I don't see Kat yet. And Kat, are you there?
This is Cappy and Jackie's.
Correct.
This is MIC.
Ah, got it. Kat, Jackie.
I'm right here.
There you are. Hi, Jackie.
Yes. Cappy's also on too.
Cappy.
Hey, hi everybody. I'm Jackie. I'm Leon with the Micronesian Islander Community, the Executive Director. Cappy, if you want to briefly unmute and introduce yourself too.
Yeah, hi everybody. This is Kapiolani Miki with MIC. I'm the Director for Health and Community Outreach.
Okay, next slide. All right, so we're really excited about the adventures that we've taken, especially with this fellowship opportunity. So things that we've done included having community conversations, and that involved bringing in Micronesians to just talk about what health looks like. That's when we talk about prenatal care, that's not something that's really talked about. So it's just being able to engage in those conversations with the first step. We also engage in state conversations, specifically with Senator Lisa Reynolds. And we also, in addition to that, we now have representation on the Oregon Maternal Mortality and Morbidity Review Committee. We also have a representation on the Oregon Public Health Advisory Board, and where I've had conversations within those circles asking about whether or not we'd be able to bring forth, once again, a maternal mental health review committee or some sort of committee that focuses on mental health and perinatal care. And we also received funding from the Department of Early Learning and Care, which is specifically focusing on people from birth to age 5. And historically, a lot of our work has been more towards when kids are 1 and older, but now we're going to be focusing a little bit more on prenatal preparation, as well as talking about how a mom's mental health is doing during that first few years after having babies. And while we don't have it listed on here, we also received some funding to do some additional reproductive health outreach that we're really excited about for the next steps. Next slide. So where do we go from here? We have several goals that we actually have in mind. First and foremost, we actually are starting a larger and more in-depth collaboration, both with people at Linfield University, based in McMinnville, Oregon, and Washington State University. So we will be doing a cross-state collaborative effort. We're also doing storytelling opportunities specifically with members of our community to learn more about what have been their experiences with prenatal care, talking more about stigma associated with mental health. We're also going to be doing presentations on birth stories and birth practices. And our third and final goal, which we're really excited about, we are making a goal to, within the next year, to go do another visit to the islands, specifically to Chuuk and to the Marshall Islands. And then in addition, we learned that there is a Pacific Islander birth collaborative group that's going to be meeting in Hawaii, I believe in October. And the goal is to fundraise so that we could go to Hawaii in October to be part of that birth collaborative, which includes a big chunk on maternal mental health for Micronesians.
Great. Yeah, exciting to see the incredible work and the leadership that you two are taking in the Micronesian community for maternal mental health. Thank you, Jackie. And now, Kat, so these two groups decided to do 2 action plans, which I had forgotten about. So thank you, Jackie and Kat. Now over to you to talk about the work that you've been doing with PSI.
Yeah, we are really lucky to have Jackie and Cappy nearby, but they also serve a greater population outside of they serve Oregon and Micronesian and Pacific Islanders outside, and so that's a really cool niche that they have. Next slide. My name is Kat Peterson. I run a small peer support nonprofit in Salem, Oregon. And if Lenore wants to introduce herself really quick, maybe.
Yep. So I'm Lenore Johnson. I own a private practice in both Oregon and Washington State. I'm a licensed clinical social worker here as well. Okay.
So our action plan, our 3 main goals were initially was to help support the current legislation that was already going on in the state with Senator Reynolds that Jackie talked about. There's 5 different bills, and this year we were able to go, and a few other members of PSI Oregon were able to go and testify and to work and try and increase support for those bills. And those bills included housing for housing support. They included doula support, that peer traditional worker, substance abuse. Let's see, and a workforce task force for perinatal workforce. Right now, all of them are sort of stalled in the joint ways and means, and probably are stalled. But one is currently moving, which is not on here, but it's Senate Bill 690. It's moved really fast in the last 5 days, and is now sitting in its 3rd reading of the House. So it was a Senate bill moved through, and that is to protect people who are pregnant or have a child under 12 months from eviction, because we have a really high, our housing, we have 14% higher homelessness rate for children under 1 than the rest of the United States. And so that's a really big one, as we have a very vulnerable population. Our other goals included increasing traditional health workers' role in Oregon. And while legislation and policy legislation isn't moving fast that way, we've been working with some CCOs, using some joint efforts with different peer organizations to try and move some policies within this Medicaid care organizations. And then our last goal, and the thing that we earned an F on in our report card, is screening. And this is something we're still actively working on. is trying to improve screening rates in Oregon. And I'll turn it over to Lenora.
Excellent. So, as Kat said, when we looked at the report card, areas where we were getting C's is seeing candidate coverage. And our goal is also to make sure we continue to work with senators to pass that legislation. Kat is still working closely with folks in Salem and other regions to make sure perinatal issues stay at the forefront of policy in Oregon. So hopefully we can move the F's that we have in this area of screening and targeting, providing education to providers to the forefront. And some of the other things that we're doing, I am working on being a part of the Health Evidence Review Committee. And so what they do is they look at all policy and approve items that would go into Medicaid packages for the state of Oregon. And so ensuring that perinatal work, postpartum care is also inclusive in reviews. So for example, medication wise, making sure that information is accessible. So that committee may look and say, well, where can we find research on this information to be able to approve or say what treatment options can go in for the state of Oregon for Medicaid recipients. And so that's a part of seeing where we can impact policy changes in other areas outside of working directly with our legislators, and members of this committee work directly with the governor. So this then becomes kind of policy and legislation where we find out, okay, what exceptions need to be made for each rule. So we wanted to look at working with our legislators as far as folks in Congress, but what could we do in this other arena, which is where this evidence-based review committee comes in.
Great. I'm looking forward to learning more about that process, the evidence-based review committee. It's going to be really interesting, it sounds like. Thanks, Lenora and Kat, and our full set of fellows from Oregon. Excited to see what happens next. Up next is Tennessee, and we have one of our fellows from Tennessee joining us.
Hi, everyone. My name is Tequila Rivera. I am a peer counselor through the state of Tennessee, and also myself and my partner, Christina, who couldn't be here. We serve on the National Maternal Mental Health Hotline. Christina recently departed the hotline, but she gave the hotline, I think, two glorious years, and I'm still there, and I just celebrated my 2-year anniversary. But I will jump right in. So we really wanted to focus on the current state of our state and why our work matters. So currently in the state of Tennessee, 1 in 5 Tennessee mothers experience perinatal mood disorders and anxiety disorders. Mental health conditions contribute to 32% of pregnancy-related deaths in the state. 70% of counties in Tennessee are classified as maternal mental health dark zones, which means that there aren't any services available for maternal mental health, which is not good. And Medicaid covers 46% of births, making it a critical access point for mental health care. So we wanted to take these statistics and see how we can utilize our experiences as a peer counselor, as a nurse, and on the hotline to help fill in these gaps. So next slide. So our solution to improve perinatal mental health in the state of Tennessee, we came up with 3 strategies, and one is to tackle the rural areas. Most of those dark zones that I mentioned a few minutes ago are in rural areas where transportation is a barrier, access to any healthcare, maternal health, mental health care, healthcare in general is a hardship for a lot of folks. So we really want to work to expanding PMHC, which we both are, expanding that support into rural areas. Also, to increase funding for rural areas in Tennessee. Also, we really want to focus on integrating Medicaid because, as the stat stated, I think 40-ish% of folks that give birth in Tennessee rely on Medicaid to cover that for them. So implementing routine screenings for PMADs, covering essential services such as doula therapy, which recently has become a thing in Tennessee. We just have to work on expanding the services and the wraparound care. And this integration would support early detection and reduce maternal mortality rates, specifically in those dark zones. So our vision, our big picture is a 40% increase in access to care by 2027, a 25% reduction in postpartum depression across the state, and doubling the number of peer support groups in rural and BIPOC communities in Tennessee.
Great. Thank you so much. Great to hear what's happening. And then I'm dropping into chat again a link to the Dark Zone report, which I shared earlier, but want to make sure folks can follow along. I'm glad to hear that it was useful in Tennessee in setting your goals, and we would love to help you monitor your progress with some data sets that we have access to as well. So exciting. And our last fellows pair cohort is coming from Vermont. So over to you, Vermont.
Hi, everyone. My name is Kate Littlefield. I'm a licensed clinical mental health counselor and have my own private practice here. And I'm here in my role as liaison and co-advocacy chair for the board of PSI Vermont. And I'm here with my colleague, Lindsay.
Hello, I'm Lindsay Lachant. I'm a certified nurse midwife, IBCLC, PMHC, and co-chair of PSI Vermont. We're a relatively new board and early in our work, but the past 12 to 18 months, we've already done a little bit of outreach with the PQC, the DPH, and we're working on networking and creating more visibility for PSI Vermont in the state. I just wanted to mention that in the slide that you can see, we did use the recipe for state policy change when we were kind of, as a foundation, as we were doing this work, and found out that Vermont does have a perinatal mental health awareness day proclaimed by the governor, and also kind of started our search on identifying legislators that might be supportive of maternal health and women's health policies. So I'm going to give it over to Kate, and she can go in more detail into our action plan.
Great. So really the start of our action plan, what we learned is that Vermont does a lot of really great work in perinatal mental health, but it's very siloed and people don't really talk to each other. And Vermont does this weird thing where we're like constantly, we're fiercely independent. And so we're not looking at the bigger national landscape always all the time. And so our first goal for year one is going to be really developing relationships, connecting with the commissioner, sharing resources, creating common goals. And luckily, Vermont was awarded the Maternal Health Innovation Grant, and they're using a portion of that money to come up with a maternal health strategic plan. And we have joined the board to be part of that strategic planning process with the goal of, supporting that process, but also helping the state to align its strategic plan to the really good work that's already being done by the Policy Center with their 15 by 30 and other resources that are already happening, states that are really leading the charge. We're at a C. I think our report card just changed by a third of a grade. So that's what we're working on for phase one. And we've already connected with the PQC here. I've presented twice to the local PQC. We've joined the Maternal Health Strategic Planning Board. And so that's going to be phase one. In phase two, which is on the next slide, we're really going to start to leverage those relationships to expand coverage of different things. So 2025 has been a really banner year for maternal mental health legislation. There, as Lindsay mentioned, where legislation just passed that Lindsay was a really big part of to get to have birthing centers and have a reimbursement for doulas. But I really, part of what I took away from this is that there is so much more kinds of care through peer supports, through alternative or alternative or adjunct care that makes care a lot more accessible and helps to bridge some of the gaps and disparities through offering different kinds of care based on individual needs and preferences. So we're really going to be, after we build these relationships with our community and get on the same page, we're going to then try to leverage those relationships to go to bigger insurers and pass legislation that is aligned with the strategic plan. Get more leg through it, and then we're going to really carry it through steps 3 through 6 of that recipe for policy change that you see in the corner of our slide.
Amazing. Thanks, Kate.
Oh, one more thing. That was a big deal. In April, Vermont passed Black Maternal Care Awareness Month as a permanent, what is it called? Concurrent month or recurrent, whatever.
We know what you mean. I don't know the word either.
I think we get it. Yeah. It's a really big deal though. It seems like it shouldn't need to be a big deal, but it is. But it is, especially given what we've learned about the landscape. And I'm so grateful for the Policy Center. I've had the great joy of getting to connect with Joy more personally, and it's just been a huge growth spurt in the very best way.
Thank you so much, Kate. That's awesome. And anything else, Kate? I think we're all set here. Very good.
All set.
We are going to open it up for a brief conversation. We have about 5 minutes for Q&A before we talk about next steps and wrap up our ceremony. All right, so we invite anyone to drop into chat questions for other fellows specifically, or if there's something more that you want to ask about as we wrap up today's session. In general, happy to entertain those questions as well. And as I'm waiting for questions to come in, I did want to flag, I put into chat, but it got mumbled with something here that I did want to share some good news regarding Medicaid and the federal proposals, the big, beautiful bill in the House and the Senate version that was introduced last week, I believe it was a few days ago. Neither one, even though there's drastic cuts to Medicaid, meaning many people will lose coverage, they maintain coverage. Both versions maintain coverage for pregnancy Medicaid without work requirements and postpartum Medicaid extension. The income levels we're looking at, if those income levels may be changing and states have some authority over that. But all in all, I think, good news for our population. Of course, we know women need ongoing care and their kids to protect their mental health after a year postpartum. So still a lot of work to do, but the perinatal period specifically, the traditional perinatal period at least is protected right now. And Dev, I see your hand up, so I'll turn it over to you for question or comment.
Hi, yeah, I just listening. I'm so amazed and proud to be here and all the work everyone's done. And I'm listening to all the work that we're doing in parallel, and so many of our states have so many similar needs. I'm looking to the future, to a national level of getting federal support, and I'd like to know if anyone has suggestions on how we can stay in touch in terms of a central place where we can report all of these advances and all this progress that's being made. And so if someone else makes progress in something we're having a hard time with, we can say, how did you do that? Or, I've learned a lot listening to how you guys did everything today. I would like to keep that going.
Yeah, thanks, Dev. Well, that's a nice segue. Keep your other questions coming all, but it's a nice segue into then what's next with the fellows. We did talk about some of this in our one-on-one sessions, but we want to let folks know that the listserv will remain open. You can see it here. And Stacy, can you do us a favor and drop that into chat? I know you're screen sharing, so if you need to pause for just a moment, if we encourage you to actually email that listserv again right now. So Deb, to that point, and then you should be able to just type in MMH and then the email will come up. You won't have to remember this. But we encourage you all to use the listserv. It's mostly been used by Stacy to share information with you, but this is a listserv that's meant to serve you in any way. that you see fit. So if you have questions or you're struggling with something and you want to know how other states are doing it, feel free to email that question, and everyone please answer. And of course, we will point to resources on our website or share, some technical insights that we may have to help answer your questions. So Dev, that first and foremost, are also hoping to do at least 2 technical sessions, perhaps combined with our government agency fellows, for all of our fellows that have graduated, on topics like HEDIS and screening measurement, payment reform. Peer support always comes up, and I think hearing several of you today talk about state-specific maternal mental health certification programs, I think it could be really interesting to have a session on that. So if we're hearing and seeing in this listserv Google group topics that keep coming up, we can do a special session on that. We don't proactively schedule one-on-one technical assistance sessions like we have in the past, but they're available to you. So if you do have a specific interest in going through the policy roadmap, or whatever, we're struggling with setting up this task force, what should this look like? Or tell me more about case management again and why that really matters. Mika, we are just talking now about a bill in Maryland that was already introduced, and how does it get modified to ensure that various commercially insured populations are not left out, for example. So we're here for those types of questions. Email, we can set up one-on-one calls. So don't be shy about that. There's also, Kate mentioned a campaign that we're helping to launch called the 15 by 30 campaign, which tracks 15 goals that we want to see be met by the year 2030. And so, Dev, I can't help but think there might be some ways to have much of this kind of coalesce under that campaign if there are shared needs and data discussions, etc. So hopefully that helps, Dev. Great. Any other questions or comments? All right. Well, I think with that, we just want to say congratulations again. It's been a true honor, and I think it's safe to say you all are the nonprofit cohort that has done the most. Hands down, such impressive work. So hats off to you, incredible work. And it's just beginning still, isn't it, right? A year's worth of incredible accomplishments and so much more to come. So thank you to all of you for rolling up your sleeves. We'll be here for you, and congratulations again. Thanks all, and please do stay in touch.
Thank you all so much. Thank you, Joy. Thank you, Stacy.